This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Hey, Southeast Texas, thank you for joining me for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. We do have one question for today. I recently lost a lot of weight, but right now struggling with excessive skin. What are my options? Certainly, we are always asking to see what can be done when you do lose a large amount of weight. And unfortunately, your skin doesn't go back to the appearance that you're comfortable with. That can sometimes happen when you're morbidly obese and your weight loss is 50, 60 pounds, maybe after a gastric bypass or gastric sleeve surgery. You can be left with a lot of loose skin, especially on the arms as well as the torso. It is unsightly. Typically, topical medicines are not really going to be that effective, just because the volume of loose skin and the degree of loose skin is just too great in order for a topical medicine to make that tight or to get it back into its normal appearance. Typically, unfortunately, you will have to seek some surgical attention from a plastic surgeon, and sometimes certain injections can be done depending on the area to make it look a little bit more tight. They're coming down with all sorts of new techniques and new injections, new certain products that can sometimes make it a little more tight, but certainly in those larger areas around the torso and the arm, unfortunately, you have to undergo some surgery to make that look a little bit better. Certainly, the price can be a little bit out of your range. Sometimes working with other physicians and getting second and third opinions can be very helpful, but typically surgery is necessary. If you have any other questions on Ask the Doc, give us a call. We'll see you next week.